Tuesday's mind emission on the toad cam. The right brain. Hemispheres. Hemispheric asymmetry. Hemispheric lateralization. Subject of contentious debate. I will show you some of the things I've been looking at recently, and these should be part of your library if you're a serious person in this field of communication, mind, self-understanding. My Stroke of Insight, Jill Taylor. This is what you might call the really good inside account of having one of your hemispheres suddenly and unexpectedly stop working and have the function taken over by the silent or the non-dominant or right hemisphere. By the way, worth noting, in terms of strokes, there are 4 times as many strokes on the linguistic or left side of the brain as there are strokes on the right side of the brain. And there are many hypotheses that try to explain why that may be the case. For some reason, the left brain seems to be more vulnerable, whether that's because of something that happens during gestation or whether that's because of overuse and overstress, I think remains an incompletely resolved point. But nonetheless, there are very substantial differences in robustness between the left and right hemisphere. The right hemisphere only gets 1/4 or 25% as many strokes as the left hemisphere. Robert Ornstein, this one is called The Right Mind, Making Sense of the Hemispheres. I think that Ornstein's book ought to be part of every NLP and mind development person's library. Ornstein does us a great service here by covering a lot of historical ground. What was known, one of the first autopsies that took place that autopsied a man who was completely normal. No one detected anything whatsoever abnormal about this guy. Took place in 1843. He was autopsied and found to have only one hemisphere. That gave rise to then a belief and a theory in the medical community that each hemisphere could in fact embody a complete self, that one hemisphere was sufficient to have a self in the fully developed adult consensus reality sense of a self, which of course leads us to a very fascinating second conclusion, that if we have 2 hemispheres, is it possible in some cases to have a normally functioning brain having multiple locus or multiple core areas of self? That might bring you to the threshold of this exceedingly dense book, which is from the series Perspective in Cognitive Neuroscience, Hemispheric Asymmetry by Joseph Helliga. What's right and what's left. This is, as neuroscience tends to be, this is a very, very detailed, dense, and extremely fine-grained, finely chunked review of the data about the differences structurally and functionally at multiple scales from microscopic to macroscopic that distinguish right and left hemisphere. And the neuroscience does not tend to support, from the neuroscience perspective, the idea of fully formed consciousnesses being able to exist separately in different hemispheres. I'm going to see if I can find a quote from Helliga. It's in here somewhere, I'm sure, in the 200s. And he does not necessarily dismiss the idea, but you have to keep in mind, whenever you're talking to neuroscientists, they are exceedingly conservative, and they will often never argue past the data, which means a neuroscientist discussing his professional subject will tend to say much, much less about it than, say, a psychiatrist or a neurosurgeon would say about it, as far as speculating what may be going on. However, Helliga does say And coming from a neuroscientist, this is quite a lot. However, there is some indication that individuals do in fact differ on their relative performance on tasks that are known to be associated with left versus right hemisphere injury. There is also evidence of individual variation in characteristic arousal asymmetry and in an individual's propensity to use a mode of processing associated with one hemisphere or the other when given a choice. While these results are far less dramatic than the claims made for strong hemisphericity, they argue for continued investigation of individual differences on all of the dimensions of hemispheric asymmetry. So Helge is taking a very academic, very conservative, very fine-grained stance, which is not really pushing for this idea of hemispheres having fully embodied self-sense or fully embodied consciousness, a separable consciousness that is a left hemisphere consciousness or a right hemisphere consciousness. So you think, well, he's a neuroscientist that puts it to bed, that's the end of that. Not so, that's not how it works. Neuroscientists speak in a certain language and they adhere to a certain code if they intend to remain working as neuroscientists. And often I've seen, especially on discussion boards like NLP Connection, someone saying, well, he heard a neuroscientist say this, but you have to understand with a lot of sort of nitty-gritty, get-down comprehension where neuroscientists are coming from when they make certain statements. Because this is probably, I'm going to say probably, the most important, the single most important book I can imagine an NLP person or anybody doing anything like NLP or related to NLP of two minds, the revolutionary science of dual brain psychology. I wonder if we can see that, by Friedrich Schiffer, MD. Now, the first thing that may come to some people's mind is, oh, this is another new age flake talking about flaky, outdated, outmoded dual brain theories. Not so. Schiffer is a psychiatrist associated with the Harvard University Medical School and the McLean Hospital, the teaching hospital for Harvard University's medical school. So I think you could say that Schiffer's credentials are as impeccable as you are going to find in this subject. And he does explicit psychiatry, psychology plus medicine, with patients utilizing a dual-brained model that he can actually speak to the left hemisphere or the right hemisphere as separate seats or loci of consciousness. And he actually uses, in here, I'll see if I can find a picture, he actually uses a specialized set of goggles. And here's a picture of these goggles. One set of goggles will only let you peek out of the very, very far right side, and the other set of the goggles will only let you peek out of the very, very far left side of the visual field. So when you put on the goggles, you can only see with one hemisphere. And he will then conduct therapy sessions. By the way, this very fine book, and I absolutely recommend it. I more than recommend it. I insist. If you haven't read this, and you're going to talk about hemispheres and NLP or anything else, you simply are missing a very, very critical piece of the puzzle. That this is what we would call fundamental or foundational research-based knowledge, not flaky New Age bullshit. It is possible in Schiffer's model of psychiatry to explicitly do right hemisphere and left hemisphere psychology, and he often will do therapy basically with one hemisphere. The patient will put on the goggles to activate and isolate the other hemisphere, and then do therapy, say, with the other hemisphere, and then integrate them. So that pretty nicely blows up a lot of these basically uneducated know-it-alls that are saying that there is